students, my name is Archna Nclex and today we are going to discuss about one of the most important topic in Nclex point of view, that is disaster management. And I also want to tell you that Nclex is becoming very important nowadays because CRS score is becoming very high and Nclex is the best way to get registered yourself and secure province nomination for your PR. So let's start the topic. So what is disaster management? So disaster management is any sudden occurrence which cause destruction of people, destruction of a large number of population or property. So कोई भी अचानक से होने वाला occurrence जिससे large number of property और large number of people की destruction हो, that is disaster management. So what comes under this disaster management? So most important is ARC, that is American Red Cross Society. American Red Cross Society. So this is the society which is approved by government to get relief in case of disaster. जैसे ही कोई disaster होगा, American Red Cross Society immediately response करती है for the recovery and for immediate response, immediate care. And next is hazmat. That is, haz means hazardous and mat means material. This is the hazmat team, hazardous material team, which include the team of doctors, nurses, medical professionals. So this team is becoming ready and get prepared for immediate response in case of disaster. So hazmat is a hazardous material team. And next is the phases. So what comes under the phases of disaster management? So in disaster management, there are main 4 phases. The first one phase is mitigation. Mitigation phase. So mitigation phase, it is the phase in which we are going to respond. We are going to be prepared for any disaster. कोई भी disaster होने से पहले हम उसको रोकने की कोशिश करेंगे. For example, हम floods को रोकने के लिए जो prevention करेंगे, we are going to make prevention for any man-made or any kind of natural disaster. So this is mitigation phase, and the next phase is preparedness phase. Preparedness phase, that means we are going to make some resources, we are going to make a team so that we can immediately respond if any disaster occur. कि अगर कोई डिजास्टर हो जाता है उस टाइम के लिए हम तैयारी करेंगे, हम किट्स प्रिपेयर करेंगे, हम अपना मटेरियल प्रिपेयर करेंगे, टीम प्रिपेयर करेंगे. सो दिस इज मिटिगेशन इज एनी team which we make before the occurrence of disaster, and preparedness to be prepared for the disaster. And then is disaster. So if disaster occur, so in case if disaster occur, we are already prepared, we are already comes from 2 phases, mitigation and preparedness. So we are already prepared for disaster. So what is the next phase? That is response. Our team which we already made will immediately respond at the scene where disaster occur. जहाँ पे disaster हुआ है, जो हमने टीम बनाई है, वो immediately response करेगी, वहाँ पे care provide की जाएगी. And the last phase is recovery. In recovery phase, we are going to start making initial actions for the recovery of that scene. जब disaster हो चुका है, उसका रिस्पॉन्स भी मिल चुका है, उसके बाद उस जो एरिया है उसकी रिकवरी करना, लोगों की रिकवरी करना, दैट इज द रिकवरी फेज. सो देयर आर मेन 4 फेजेस: मिटिगेशन फेज, प्रिपेयर्डनेस फेज, रिस्पॉन्स फेज एंड डिजास्टर फेज. नेक्स्ट इज द टाइप्स ऑफ डिजास्टर. So disaster is mainly of 2 types, that is man-made disaster and natural disaster. So in man-made disaster which means the disaster which occurred due to the impact of or due to the reason of man. For example, a war, a bomb or a terrorist attack, जो कि हम man-made खुद cause कर रहा है disaster. And whereas in natural disaster, in which the role of human is not, but it occur due to any sudden occurrence. For example, floods आना जिसपे किसी का कोई कंट्रोल नहीं है, which is a completely a natural occurrence, or landslides, or volcano eruptions, or cyclones. So these type of disasters are natural disasters. So disaster is of two types: man-made disaster and natural disaster. So next come with the levels. So what are the levels of disaster? In NCLEX they can ask about the level of disaster. So there are three levels of a disaster. L1, that means level 1, L2, that means level 2, and L3, that means level 3 disaster. Level 1 is minor disaster. Minor disaster means in which the destruction of population is less severe. The minor disaster which can be a local disaster. And level 2 is moderate type of disaster, in which the destruction of property or people is moderate type, or we can say a state level disaster. And level 3 is severe disaster, in which a massive disaster occur, a large number of population destruction or property destruction, which we can also say national disaster. So these are the three levels of disaster: minor, moderate, or severe disaster, which can also say L1, 2 and 3. So next and the most important question, that is triage. This is the most important thing in disaster management. Most of the question comes from the disaster triage. In disaster triage, basically we do color coding. जैसे ही कहीं पे डिजास्टर होगा, हम पेशेंट्स के पास जाके उनकी ओनली 30 सेकेंड और 1 मिनट की असेसमेंट करेंगे. इन दैट असेसमेंट वी प्रोवाइड देम color code. And what comes under that color code? So there are mainly 4 kinds of color code. The first color code is red. So what is the red color coding? In red color code, we place those patients which we are giving higher priority first, higher priority. And what comes in this patient? In this type of category, we place those patients who have any neurological damage, or who have any open fracture, or the patient who has who require immediate care, and which we can save if immediate care is provided. So immediate care हमें अगर देनी है, तो that patient comes under red category, red code. And the next code is yellow color code. Yellow color code means the patient who comes under second priority. Second priority means the patient, for example, a patient with open wound but distal pulse is also present. So in that case, what we can do, we can wait for the care for at least 30 minutes. That means अगर हम 30 मिनट तक उस पेशेंट को नहीं केयर प्रोवाइड करेंगे, in that case also patient can survive. So yellow color code means the patient who require care between 30 minutes to 2 hours, who can wait for their care, जो अपनी केयर के लिए 30 मिनट से लेके 2 घंटे तक वेट कर सकते हैं. And the patient who require immediate care comes under red category, and the patient who can wait for 30 minutes to 2 hours comes under yellow category. And next color code is green. So green color code is priority 3, third priority. So in these kind of patients, the patient care can be wait until 2 hours. कि 2 घंटे तक पेशेंट को हम केयर के लिए वेट करवा सकते हैं. पेशेंट कैन सर्वाइव इफ care is not provided within 2 hours. So in that case, the patient who has minor lacerations or who has close fracture, So these kind of patient can wait for 2 hours. So that comes under green category. And the last category is black. So black category is the patients who need a minimum priority. That means who are dead or expected to dead. That means वो patient जो या तो मरने वाले हैं या मर चुके हैं. That comes under black category. So we cannot waste time in that kind of patients who has zero hope of survival or who are already dead. So we have, in that condition, we are going the first priority to red category, who need immediate care and we can survive that patients. And then yellow category, then green, and the last is black category. So these are the disaster triage. And next we are going to discuss about the one of the most important question about the priority of disaster. So the sample question is, a nurse is the primary responder at the scene of a school bus accident. So which kind of patient is given the highest priority? So एक disaster हुआ है तो किस patient को हम highest priority देंगे? So first option है हमारे पास child with simple fracture. Child with simple fracture means fracture है but this is a simple fracture. And the second is child with a closed head injury. So there is head injury which is a priority, but the head injury is a closed type of head injury. This is the closed head injury. And the third one is child with severe minor injuries. So in there we can see the minor injuries which is not the immediate response required. And the fourth is confused child. Confused child means there is a neurological deficit which we are going to give highest priority, as well as bright red bleeding. Bright red bleeding means a massive hemorrhage. So due to the neurological deficit and massive hemorrhage, we are going to give highest priority to this kind of child, because in simple fracture patient can wait for 2 hours. In closed head injury patient can wait for 30 minutes. In several minor injuries, patient can wait for more than 2 hours. And in confused child with bright red bleeding, there is a massive hemorrhage. Child can go to hypovolemic shock and immediate death can occur. So this is the highest priority child and we can place it in red color code in triage. So this is the one of the important example. In these type of questions, Nclex is given this type of questions. So you have to see which category is comes under these options, and according to priority your answer will be there. Thank you so much.